You're watching Beyond Markets, where we bring you up to speed on development outcomes in Africa. I'm Kenneth, and thank you so much for joining me on the show today. Coming up on Beyond Markets, we'll explore the implications of the COVID-19 pandemic on Africa's development trajectory and also find out what policy options we can implement to mitigate the impact of the pandemic. Join the conversation on social media. Let's get your thoughts. You can use the hashtag Beyond Markets, and you can also hit me up at Kenneth Igbomor. Now, the African Development Institute is the arm of the African Development Bank charged with the institution's capacity development initiatives in looking to stimulate policy dialogues that will inform policy responses to the COVID-19 pandemic among regional member countries. The ADI set up the Global Community Practice. Now, Senior Director of the AfDB's African Development Institute, Kevin Urama, joins me now to explore how the COVID-19 pandemic impacts Africa's development trajectory and what policy options we can take to mitigate the impact. Thank you so much for joining me on Beyond Markets today, sir. And let's start first by getting your assessment of Africa's COVID-19 response so far.
Okay, thank you very much, Kenneth. First, let me just give you a bird's eye view of what the COVID-19 pandemic has done and is doing on African economies. As at yesterday, we have just over 978,000 confirmed cases of COVID-19 in Africa, with about 10,000 cases being reported daily. This has amounted to about 21,000 deaths in Africa, and about 662 deaths happening daily. In Africa, the most impacted country has been South Africa, with over 521 cases reported, and followed by Egypt, Nigeria, Ghana, Algeria. And then the least impacted economies in Africa and countries in Africa in terms of number of cases and deaths is Seychelles and Eritrea, that has just below 114 cases and 282 cases respectively. If we look at Africa and the rest of the world, one could say that Africa is least impacted in terms of the number of cases that we've had. But South Africa is coming up quite rapidly in terms of number of cases and number of deaths, coming fifth in the whole world, coming after countries like United States of America, Brazil, Russia, India, and so on. So really, the COVID-19 pandemic has been a major headwind to African economies in very many ways. If I look at the cases in terms of impacts on African economy itself, before we go to the policies that we may need in order to be able to address them, one can see that the African economies will be impacted a little bit disproportionately, not because of the number of cases, but because of the preconditions that were there in the African economies before COVID-19 hit Africa in late March, early April this year. So you find that real GDP in Africa is projected to contract by up to 3.4%. This is based on estimations by the African Economic Outlook that's published by the African Development Bank Group annually. And this contraction represents about 7.3% decline in real GDP on the continent because of COVID-19. And these estimations we made based on a thought or a scenario that COVID-19 may be contained within this year, 2020. We already see from the epidemiological data that's coming out that COVID-19 might well go into 2021. So these estimates of contraction in GDP is actually a conservative estimate, one would say. This amounts to about $173 billion to $236 billion of losses in terms of decline in GDP in Africa between 2020 and 2021. But in addition to these impacts on real GDP, we'll find that COVID-19 pandemic has triggered sudden uptick in inflation, amounting to up to 5% inflation in many countries. But the good news is that the lockdown and aggregate slowdown in aggregate demand has been helping to contain the inflationary impacts of this COVID-19 on the continent. But we also see that ministries of finance have had to embark on expansionary fiscal spending. And this is in the backdrop of a continent that already had a very constrained fiscal space and rising debt burden even before COVID-19 came in. And another part which COVID-19 is impacting Africa through is actually reduction in remittances, resources and money that we receive from Africans in the diaspora in different parts of the world. In 2018, 2019, remittances topped over $86 billion on the continent, representing about 10% of GDP in many countries, such as Cape Verde, Comoros, Gambia, Lesotho, Senegal, Liberia, and so on. So you can already see that with the lockdown that is happening in the rest of the world and the slowdown in economies globally, it's also impacting the amount of remittances that is coming into the continent and may come into the continent going forward. So this already is a big headwind for many African economies on the continent. And many African people, citizens, may therefore be pushed into poverty because of these impacts of COVID-19. We estimate that between 28.2 to 49.2 million more Africans may go below the poverty line because of COVID-19, and up to 30 million jobs may be lost this year alone. This picture I've just painted is to show how serious this COVID-19 is for Africa and for African economies, and also for the global economy in general. And therefore, countries need to take the policies for actually addressing these COVID-19 impacts seriously. But the other side of the story is that COVID-19 is a crisis that we must not let to go to waste, because COVID-19 has shown us how inequitable the current economic paradigms are. It has shown huge inequities between sectors, between people, and between countries. And it has created opportunities because it is a transnational pandemic that doesn't respect people in terms of race, religion, color of the skin, or even economic powers or political powers. So it has created an opportunity to have a fresh rethinking about how we do business in running our economies, in running our businesses, and how generally development and the business of development goes on the continent, in the continent and globally. This is because when we have COVID-19 anywhere, we have COVID-19 everywhere. So this also has tried to bring to the fore our common humanity, the fact that in planning policies in Nigeria, we should think about our neighbors. In planning policies in South Africa, we should think about our neighbors. And the same for the United States or China or anywhere in the world, because anywhere that COVID-19 is impacting, economies will happen. The current COVID-19 we have emanated from just one country where there was this impact and it was not contained. So having said this, I'd like to also point out that Africa has had huge advantages in terms of its demographic structure. The demography of the continent in terms of the youthful population, the structure of our residential quarters, especially in rural areas, the population densities in different rural communities has helped to slow down the impact of COVID-19 in many ways. But as I've already mentioned, our preconditions has met that we have not really been very ready to be able to address the pandemic in many, many ways. And that is why at the African Development Bank Group and the African Development Institute have established this global community of practice that you just mentioned at the start of this session to be able to bring together global experts to start to think, how can we rethink the economy and be able to build back better economies that is more resilient, able to adapt, able to absorb shocks, and able to innovate in order to transform itself to be able to maintain its functions even after the COVID-19 pandemic has come and gone. So this is just a background in terms of
All
the
right, quite an
impact of
interesting breakdown that you've put down together, Professor Urama. Quite an interesting breakdown that you've given so far, talking about the preconditions that Africa is facing and the new thinking that we need to get things going in this new normal. But I'd like you to speak to how we can now work to enhance, the resilience in these African economies, because we understand that each and every economy in Africa is facing different challenges, but building resilience definitely will mean that it's not the same. It's not the same solution that will mean for every other country. But how can we start thinking around that new thinking around resilience and building that resilience for the economies in Africa?
Okay, now the notion of resilience involves three things, and these are the things that we really need to focus on in terms of how we build out. One is the absorptive capacity of the economies, the adaptive capacity of the economies, and the transformative capacity of the economies. We need to be able to have systems that can detect the challenges before it happens and be prepared to adapt to it. But when it happens, we'll be able to absorb it. And after it happens, we'll be able to transform ourselves in order to be able to move forward, going forward. Having said this, policies in Africa, as in many countries, COVID-19 has shown has been a little bit more reactive instead of preemptive to try and address some of these cases. So the issues about adaptation and building resilience in African economies is simply about trying to ensure that every ministry, every sector, every institution builds in these three levels of capacity that I have mentioned. And when going forward in this interview, I will come to specific policies that we have come up with based on the dialogue we have had globally on macroeconomic policies that we need in order to be able to shore up our economies, and policies that we need in the agricultural sector in order to be able to build resilient food systems, and also policies that we need in the health sector in order to be able to build resilient health systems, what we call inclusive health systems in Africa.
All right, Dr. Urama, let's just hold that thought for a second and let's take a quick break. Definitely when we come back, we'll look into the policy that is available and how countries can go about ensuring things like food security. And you can tell us a little more about that global community, and we'll continue Beyond Markets after the break. Welcome back to Beyond Markets. If you're just joining us, my guest today is Kevin Urama. He's the Senior Director of the African Development Institute of the African Development Bank. And we've been exploring policy options to help mitigate the impact of the COVID-19 pandemic on African economies. And before we left off, Prof, we were just about to get into some of that policies that you from the sessions you've had from global thinkers on how to best mitigate the impact of COVID-19 on African economies. And I'd like you to share some of that.
Okay, thank you very much. The policy options range from very simple things to a little bit more complicated things. The simple ones, which are very easy to practice, is simple social distancing and personal hygiene, frequent hand washing, and wearing masks. These things are not complicated, but they actually save lives. So we need to actually implement this and enforce this across the continent. The next is creating social protection policies that actually tries to help to protect the vulnerable populations. We know that when we have social distancing in Africa, there are a lot of households that do not have access to food, access to medicals, access to hand washing facilities, water and sanitation, and so on. So governments need to be able to step in to try and protect them by providing such social protection policies there. Another policy that is key is testing. Trying to test and test and test and be able to identify the COVID-19 patients that needs to be isolated to avoid the transport of this transmission of this COVID-19 from patient to patient. And the other policy that we need to have there is basically public policies regarding communication, to actually communicate to the people what this COVID-19 is, the nature of the virus, and how it transmits from one to another. COVID-19 cannot move from one place to the other. It requires us as human beings to move it from one place to the other. So containing it requires changes in human behavior. And that changes in human behavior will come when there's clarity and people understanding what it means and how their actions protect themselves and protect their neighbors.
All right, but what about from the fiscal side of things, from what governments need to do to help reduce the socioeconomic impact on their citizens?
Now, the fiscal side of policies in Africa, there are quite a number of policies that we need to actually think about. Let me start what governments should do globally, because COVID-19 is a global pandemic, and it's not something that countries alone can resolve. Like I've said, when there's COVID-19 anywhere, there's COVID-19 everywhere. So global governments, the G20 and the rest of them, are encouraged to actually try to think about public and private debt restructuring, structuring debt relief packages, and targeted debt forgiveness. Currently, we do have actually debt moratorium, which the G20 is already talking of and implementing. But considering the impacts of COVID-19 on African economies that already has small fiscal spaces, and also, as I've said in the beginning, already has high debt burdens, countries should actually push for greater debt forgiveness instead of debt moratorium, which just pushes forward the payments to a future date. We also need to scale up investments in early warning systems, like supporting centers for disease control, so that they will be able to detect these viruses, and including COVID-19, and be able to try and contain them when they do occur. But also scaling up investments in key sectors like agriculture and health sector, to smartly invest in these key sectors that has to do with the health and wellness of people, so that we will be able to absorb this kind of pandemic when it does happen. In terms of monetary and fiscal policies, most African countries don't actually have that much fiscal space to be able to roll out the fiscal stimulus to the levels and scales that it can actually make a dent in terms of making an impact on this pandemic on the continent. But countries that have that fiscal space should as well do that, because it is very, very important. But within that, we know in Africa that transparency and accountability is a major issue that we also need to think about. So even when fiscal policies are implemented, how do we ensure that they get actually to the end users, the target people, which are mostly the vulnerable households and small and medium-scale enterprises that need this kind of support more and more? That is another area that we really need to think about as we go forward in policies for this. Now, let me speak to agricultural policies, since I mentioned agriculture. Okay.
All right. Before we get into agricultural policies, I'd like you to, as you think of putting that response together, also talk us through some of the targets that you're setting with the global community of practice.
The global community of practice has three key targets for which it was established. One is to bring together global experts, both in Africa and outside of Africa, to actually look at the potency of every policy that we try to implement, the multiplier effects on the different sectors, and also the applicability in terms of how do we really have the capacity to apply them. So that is changing the game in the sense that we bring Africans and non-Africans, policymakers and non-policymakers, civil society and private sector together in one room to actually start crafting policies to respond to this pandemic. That is already happening. And like I've mentioned, we have already had 3 major global convenings that brought together over 1,700 experts, and the policy briefings have already been sent to the African member states to inform their actions on this. And then we have several other events planned on public and private finance management, on financing natural capital, on securitizing remittances, on strengthening institutions for public governance and transparency, on dealing with strengthening different parts of the economy to ensure that Africa is ready to actually implement those policies that are being proposed. That is one key area. Then the other key area is then supporting African countries with training, technical assistance, and policy dialogue, going country by country to actually deal with what are the issues. It's well and good to say governments need to roll out fiscal policies, fiscal stimulus, monetary policies. But we know that in practice, there are several context-driven issues that we need to deal with. So coming down to the countries to be able to deal with those, working with the different arms of the African Development Bank Group and our sister MDBs like the World Bank, IMF, and also African institutions like the African Economic Research Consortium is another major thing that the global community of practice is set to do. And then the third part of the global community of practice is what we call a virtual marketplace, more like a global campus where any policymaker in Africa can ask questions and receive responses real time on policy challenges that are facing without actually having to go looking for consultants everywhere and trying to get monologues, which happens when you get an expert from somewhere else, and then that one person or that one company comes and sits down and tells you what they know. But in this global community of practice, we're able to leverage the knowledge and skills from everywhere in the world, what has worked, what has not worked, to be able to provide context-specific, evidence-based science and policy advice to African countries. So that is what the global community of practice is trying to do.
Interesting, it's coming at this time, and definitely quite a lot to do. The continent is faced with challenges around food security, ensuring food security. Also, seeing agri-food systems also being threatened when we talk about supply chains and all of that. But I'd like you to look at the AfCFTA that's about to come on board, and when we talk about improving the integration outcomes on the continent, and how best we're going to approach this going forward.
Now, the Africa Continental Free Trade Agreement is a game changer for Africa. COVID-19 has actually shown the need to actually rapidly scale the implementation and domestication of that policy across the continent, because Africa has largely depended on the global economy for its food, for its energy, for its trade in its natural resources, and so on. And the big market in Africa that is over 1 billion people and will grow fast, has not been really highly utilized. Intra-Africa trade has been very low and largely informal. So implementing the Africa Continental Free Trade Agreement will be something really useful now, and COVID-19 should create the impetus for us to accelerate it, because generally Africa needs to start thinking home. Africa needs to start thinking about shortening value chains instead of globalizing value chains. Because what we've seen in COVID-19, where countries had to shut down their borders and actually start stockpiling food and medicine in order to serve their own populations, creates that impetus that Africa should do the same. And while doing the same, it doesn't mean diverging yourself from the global economy, but actually trading with the global economy in terms of value addition, moving away from trading on natural resources with limited value addition, and depending on the global economy for our food, for our fuels, for our everything. Let us try and build productive capacity within the continent. So, and to do that, we will need to implement what the African Development Bank Group has called the High Five strategies, brought to us by the African Development Bank President Akinwumi Adesina. We need electricity. We need to light up and power Africa in order to be able to allow for digitization of trade, in order to be able to allow for that ACFTA to function. We need to be able to feed Africa, creating green corridors for preferred trade between countries on the continent, rather than importing rice from Vietnam and far distant countries with high expenses of importation. Africa currently spends quite a lot of billions of dollars on importing food, predicted to reach up to about $110 billion by 2025. You can imagine how much that will mean for Africa if we invested it on building agricultural systems, inclusive agricultural systems, building value chains so that we can actually produce and sell food within the continent. And our staple foods on the continent are similar. So there's every impetus for us to actually do that. And the same applies to health, the same applies to energy, the same applies to industrialization and all sorts of things. So for me, integration is the key. And Africa need to actually implement the ACFTA fast in order to build resilience in our economies, because value chains that are shorter are always more resilient because the exposure to risks, to disruptions are less. The same way, countries need to start building their agricultural systems as well in order to build that same resilience at national, regional, and continental scales.
Definitely, our policymakers have their work cut out for them. Definitely, when you look at the amount of work that needs to go first, even in building inclusive health policies to drive the post-COVID environment, and also looking at the kind of work that needs to be done, especially with dialogue and collaborations that are needed across. But then, how can they now prepare in this new normal?
Now, preparation for the new normal in Africa is a little bit very simple, because our agricultural systems, for example, is already amenable to the new normal. Most African agriculture are small-scale farming. And then if we actually scaled up that farming system and started providing social security and de-risking investments in small-scale agriculture and creating links to markets through digitization and use of different technologies, then we can actually boost agricultural productivity on the continent without having to rely on global markets. And then in Africa, the middle class is growing and food is something everybody has to eat. So it's not about demand. It's actually what has been the problem in African agriculture is logistics. So where food is produced, increasing productivity, and also creating opportunities for processing and the logistics of transportation, basically building value chains. If you ask me for one word that we should focus on as policymakers, is that in every sector, we need to build national value chains. We need to build regional value chains. We need to build continental value chains. Allow for value addition and free flow of these products within African countries. And then also trading globally when we have satisfied our regional needs. So de-risking agricultural value chains, de-risking health value chains, de-risking value chains in education and knowledge and everything is a key thing that we need to do in order to adapt to this new normal. The second one is to provide targeted support for smallholder farmers, small businesses, and small households in terms of income, households that are more vulnerable to shocks, so that we can actually create a more inclusive economy where everyone can participate and productively grow our economies. We also need to initiate targeted support for the blue economy. I single out blue economy because a lot of fish we consume on the continent are imported. But these are very simple technologies that we can actually do even in urban farming, in urban areas, and be able to supply our own food. And when we do that, we'll reduce the consumer price index on the continent and create a lot of stability. So we need to create green channels and green corridors to enhance inter-regional trade on the continent, and even within countries to enhance flow of food and flow of products from rural areas to urban areas and vice versa. Those are very key things. But the good thing is, on the continent, when you look at every sector, there are already policies and strategies that we can already implement in order to move it forward. The Maputo Declaration for Agriculture is there. We have the Lagos Plan of Action. We have the CADEP process. We have so many policies that has been already enacted, very well thought out. The problem here is implementation. The next part of it is public-private sector partnerships. The governments cannot do this alone. So we need to create policies that enables the private sector to participate and actually help us to leverage and move these things forward. We need to reintroduce some of the policies that we have stopped before, like in agriculture. We need to reintroduce and revamp farm cooperatives and marketing boards, so that we'll be able to have influence in terms of pricing of products. Thank you.
All right, quite a lot to absorb. There are definitely a lot very interesting contributions definitely on the show. First, talking about how our policies first needs to adapt, absorb, and then transform. And also in policy recommendations, you also mentioned the fact that we need to build value chains, we need green corridors, and then we need to get those public-private partnerships running through. Thank you so much for your time and contributions on the show today. I've been speaking to Kevin Urama, he's the Senior Director of the African Development Institute of the African Development Bank, and he's been talking about policy options to help mitigate the impact of the COVID-19 pandemic on African economies. That's all from Beyond Markets for today. Thank you so much for being a part of the show. Remember, you can catch the show at 5 p.m. West Africa time daily and have access to all episodes of Beyond Markets on our website. That's at cnbcafrica.com. From me and the rest of the team, enjoy the rest of your day.